During labor, we can say that she's in labor if her cervix is dilated to 5 centimeters and she should have the contraction 3 to 4 contraction in 10 minutes. We allow her to move freely to adjust her position to the position that she feels comfortable with. If she has no complication, we're gonna do the auscultation every 30 minutes and discuss with her about options for pain relief as well. Jump into the shower if she prefers some warm shower to help her with the pain relief. Vaginal examination we normally do every 4 hours to see how is she progressing. CTG is not always the case to do during labor. We just need to do the CTG only if indicated. Then you found that she's fully dilated or you can see head on wheel. So it's time to prepare for things. Check the fetal heartbeat after every contraction or every 5 minutes. Straight away you put baby on mom's chest and then you know the time of baby is born. Check how baby is doing. Is baby crying? Hello everyone, welcome back again to my channel. Yeah, with me again, Julia. If you don't know me, I am an overseas qualified midwife that migrated to Australia through the OBA pathway, and I started create this channel to share with you about my experience to get the midwifery registration here in Australia. And in this video, we are going to talk about vaginal delivery. And this video will be a part of my Midwifery OSCE Preparation Playlist as well, so feel free to check out in my channel. I signed a confidentiality agreement when I did my OSCE, and it said I agree to not disclose or discuss with any person any information related to the examination. Therefore, this series of OSCE preparation videos will be based on my midwifery practice in Australia as a registered midwife, and I cannot discuss any content or information regarding my experience in the OSCE exam. As a midwife, vaginal delivery is one of the important skills to practice in this career, and here is how we support the woman during labor and birth in Australia. During labor, we can say that she's in labor if her cervix is dilated to 5 centimeters and she should have the contraction 3 to 4 contraction in 10 minutes. Otherwise, if she's here for induction, when we start the syntocinon IV drip for her, that's when we start the partogram as well. So during this time, we allow her to move freely to adjust her position to the position that she feels comfortable with. She can be in a standing, she can mobilizing around the room, she can sit on the birthing ball, do whatever she feels like it. If she has no complication, we're gonna do the auscultation every 30 minutes, and that we can check the fetal heart rate and also the maternal pulse as well. Make sure that they're both in the normal range. Then we're gonna do the observation. So observation we're gonna do every 2 hours. So we check the blood pressure, temperature, oxygen set, that every 2 hours. Only the maternal pulse that we're gonna do every 30 minutes. We can discuss with her about options for pain relief as well. See if she prefer to do some deep breathing exercise, we can give her advice on that. She can jump into the shower if she prefers some warm shower to help her with the pain relief. She can readjusting her position to see if that help her a little more. In terms of medication, she can have the fentanyl, like fentanyl for subcut for pain relief. She can also have morphine, or she can have the epidural as well if she want to. Then we're gonna do the vaginal examination. Vaginal examination we normally do every 4 hours to see how is she progressing. CTG is not always the case to do during labor. We just need to do the CTG only if indicated. Like if she's here for induction of labor, then she needs a CTG to be continue monitoring. If she have some complication like preeclampsia, then she need to be on continuous CTG monitoring. Ongoing reduced movement, or if she's having the epidural, then we need to assess put her on a CTG as well. So you need to make sure that baby is doing okay, because she cannot feel the pain. So we need to make sure that how is her contraction and how is the baby is doing during that time. Okay. Once she progresses to fully dilated, then it's time for the second stage management. When you did a VE and then you found that she's fully dilated, or you can see head on wheel, so it's time to prepare 4 things. So first thing is the equipment. So you need to get the delivery set. The delivery set is going to be in a pack and it's going to be on the trolley. And also prepare the syntocinon as well. So syntocinon 10 unit for the active, the stage management if she consented to. You can also prepare the warm compression as well to help about her peri. So that's about the equipment. And then you need to prepare yourself. So yourself, you need to wash your hand, wear your gown, get the goggle in, and get the sterile gloves for you. And then you need to call the second midwife. So every birth you need to have 2 midwives presented there. And last thing, you need to prepare woman. So you need to tell her what is going on now. Okay, you tell her that her cervix is fully dilated, and now we're gonna start the pushing stage. And she can push when she has the urge to push. You can help her with the adjusting position as well. See if she feels comfortable pushing in side lying position, squatting, or any position that she's comfortable with. Once you're ready, then it's time to support her during delivery. So give her some warm compression and guide her to push effectively by pushing down to her bottom and push 3 pushes per each contraction so that the pressure can support together, and let her rest in between contraction. And also you need to check the fetal heartbeat after every contraction or every 5 minutes. Once she pushes effectively, then you can support the baby's head. So baby head is coming, so you can do the hands-on technique, support the head of the baby, and then slowly wait for restitution and delivery the shoulder and body. And straight away you put baby on mom's chest, and then you know the time of baby's born. Check how baby is doing. Is baby crying? You might need a little bit of tactile stimulation to stimulate the baby and make sure baby is nice and pink and crying okay. Put straight away on mom's chest so they can do skin to skin. And then put it's like a bluey, or it's called pinky, bluey or pinky, or it's like a sheet to put that under her bottom so that you can assess the blood loss. Okay, and see if she's heavy bleeding or if she have any postpartum hemorrhage, so you can assess from there. And then give her the syntocinon. If you have the second midwife there, normally the second midwife will help you with the syntocinon for active management in the 3rd stage. But if you are there alone just for some reason, then you need to give her the injection as well if she consented to. So syntocinon 10 units IM. Or in some hospital we do IV as well. Once you gave her the injection, then you come back to the field and continue with the placenta. So you need to see the size of placental separation. You can see gush of blood. You can feel that there's no pulsation of the cord, and you can see that the uterus is contracting. So yeah, if that happened, then you can say that okay, the placenta is completely separated, and then you can deliver the placenta. And we normally do control cord traction here, so that you put one clamp on the cord, and then you put the hand to guarding the uterus, and then you do the control cord traction and slowly deliver the placenta. Note the time of placenta deliver, and then check her vital signs at the end and make sure everything is okay. And I think that's it. And yeah, I think that's it. And then you can help her with the breastfeeding or support her to skin with baby. Alright, so I think that's it about the vaginal delivery that we do in Australia. And I believe that it is similar to any other countries in the world as well, because vaginal delivery is about to be like that. And if you have any question, feel free to ask me in the comment down below, and I will get back to you as soon as I can. Don't forget to give me a like and subscribe to my channel as well. That would be a really good support. Thank you so much for watching until the end, and I will see you in the next video. Bye bye for now.